Hey everybody, Joe Yuhan here, wanting to talk through the cranial manual therapy that I'm doing. And so first we have to understand and maybe accept the fact that these bones can move. And so if you really kind of zoom in on this is basically a tongue and groove joint. And so it's got a little bit of give in it, which is really important because if we hit this hard enough, we need to be able to swell a little bit, because if we don't, it's bad news for the brain. And so these can move a little bit. And so what happens when we hit our head, or when any other insult, trauma comes to the head, sometimes it can be a repetitive one, which I'll talk about. It doesn't just like dent it. What it'll do is the force will distribute into what's called a torsion. And so if I get hit on the side of my head, on my left side, the force can drive, for example, the temporal bone, parietal bone, frontal bone, forward and to the right. But if this moves forward to the right, this side, this bony structure also has to move to the right. So you get what's called a right torsion. And so everything in the head then will shift over. So it'll be kind of forward on the left, back on the right. And so you can both feel this, and sometimes when it's significant enough, and if you have a trained eye, you can see it. And so what I do from an assessment standpoint is I will just put my hands on somebody and feel. And so for me, what I've been working through isn't necessarily acute trauma, but the trauma of having braces and having headgear that jammed into my head on and off from age 10 to age 14. So first it was this sort of basket thing that then connected to my maxilla and zygomatic bones through my upper teeth. And then I also had a strap that pulled basically C2-3 and sheared it forward. And so what I feel in my system is I have this, it's really easy to move to the right. So this is this paired rotation. So I'm gonna try not to move my head when I do this, but I can move it easily this way. I can't really undo it that way. And there's layers to this. The fascia can be involved in that lack of mobility, which overlays the superficial fascia, the skin, the scalp, overlays the bones, then the bones themselves. And even inside the bone, you have then the membranes that live in here that surround the nervous system, surround the brain. All of those things can get into a torsion. And so what I'll do on a client, especially when I feel this whole body tension, or they're telling me everything on my right side, I'm like all tight here. What I will do is I'll visualize and feel. And so for me, again, if I twist, there's a lot of movement to my right. You can almost see it. I can't get it to go back. I can't even get the skin to go. If I go lots of movement, not much movement. So I have this right torsion. And what that does for my body is it just draws everything, all sorts of tension through my left side. Secondarily, what tends to happen too is if there's any up-down angle to this, then you'll also get a steering wheel rotation. So you'll get a relative elevation of, say, the left temporal bone and a depression of the right. That would be a steering wheel torsion of the cranium to the right. Again, it's not that I'm tilted, but it's literally the bones and the fascia easier to move steering wheel right than it is steering wheel left. And again, you can see this. Lots of movement left, because that's where it likes to go. Very little movement back to the right. And so when I'm treating this out, what I'm trying to do is to counteract those forces two different ways. Number one, by pairing the correction. So I'm always doing something with two hands. So I may notice on a client, oh, their temporal bone, and you can even see this with mine, like that's the difference in height. If I come really close, that's the difference in height. I'm elevated on my left side. I'm depressed on my right. Now, I could just push this down on the left, But if I want to get a full and sustained correction, I need to do both. So I am actively pushing up on the right and down on the left. Meanwhile, if I'm going to do a torsion correction back to the left, I'm going to try to take the temporal bone on the left and take it back while I'm taking the temporal bone on the right and taking it forward. So that is the sort of paired bony correction. The other thing that we try to do is to do layers. And so we have 3, at least, layers. So if I'm feeling a scalp tension, I may put a specific layered approach to the scalp. And what's interesting for me, because of my headgear, and possibly the one concussion that I've had, is that I am stiff in my occipital bone and in the junctions of my occipital bone with the parietal and the temporal. So I will swirl that and try to free that tissue so it can move. Again, if I'm going to torsion correct, I need that to move forward on the right or towards the left. So I'm taking that turn back that way. The next layer is an intention on the bones themselves. The last is using Barral Institute techniques to go deep through the bone, believe it or not, this is possible, to mobilize the membranes within the skull that are surrounding the brain. And so that's my approach. The last thing that's been really helpful then, especially when we think that there is a cranio-cervical implication for a stiff shoulder, a rib cage, a pelvis, something that's just being sucked up because everything's getting pulled over here, I will then add an extremity movement. So I'm going to have my hands on somebody. I may do a torsion correction either in the rotation, which is more of the transverse plane, or I'll do a frontal plane up, right, down, left if I'm trying to get them to go back to the left, while adding arm and or leg movement. So while I've got my hands on them, I'm having the client do certain movements. And this is extremely helpful if you have somebody with chronic stiffness. Oh, I've had this stiff shoulder for 10 years or 20 years and it doesn't matter what I do. It's often a fascial connection with this cranio-cervical dysfunction. So if I add shoulder flexion or shoulder abduction, just some lengthening of the fascia while I am performing that torsion correction here, it's sort of wiggling both ends. I'm helping to free the fascial connection here, almost using this as a long lever mobilization force, but I'm freeing the shoulder. For me, the most interesting thing then has been, because so many of my issues are in my legs, I will pair it with a lower body rotation where I'm on the ground doing things here, doing maybe a transverse plane torsion correction or a frontal plane while doing lower trunk rotation. And this has been like fantastically powerful to improve the fascial mobility of my lower body. Constantly tighter on my left side, everything tighter. But if I go into left rotation, which is my stiffer, dysfunctional half of my running stride, I loosen that. And an interesting side thing that happens to me is I get an immediate release of nasal passage clearance that I've just had for years. I've had this subtle imbalance of being more congested on my left side. I do this, I pair a cranial movement with trunk rotation, it immediately opens. So that's what I'm doing. It is a meld of different schools, IPA, Barral Institute, some of the things that I've learned through the mentorship that I've received, but I've just gotten tremendous results performing this sort of post-traumatic correction to the cranial structures. And I think the last thing I'll say is that we've all had cranial trauma because it doesn't take much. It can be just subtle little hits. It could be something that's really historic. It could be falling off your bike when you're 5 or falling out of a treehouse. These things that maybe we cry about for an hour and then we don't think about ever again until we think back. And so this approach has been enormously helpful for people who've had moderate trauma, who can be like, oh yeah, that car accident, that bike accident, I got punched once. I mean, the crazy stories that people have from when they were younger, but it bakes in 30 years later, they're having problems. So this has been a phenomenal technique for my chronic complex pain clients who just have this dysfunction housed cranio-cervically that's just drawing tension elsewhere in their body. So that's the introduction. I just would love to see other people playing with that and telling me how it works for them. Good luck.